believe it? 40 years since that neuroscience class.
I can't believe it.
I can't believe it.
I'm so glad we got a chance to catch back up, though.
Time flies.
I know. You know, my little grandson, Benny, he's at Elon University now, and he's majoring in neuroscience. It's a major now.
I know. It was just a minor when we were there, just being established.
I know, it's crazy.
Can't believe it.
I know. Taylor Ray, are you okay? Taylor Ray? Okay, I'm gonna call 911. You'll be okay. Dana? It's gonna be okay. It's gonna be okay.
Hi, I'm Dr. Shenharz. The nurses are going to take your friend upstairs to run some tests. Let's go talk in my office.
Okay. I don't know what happened. We were talking one minute and then the next, her speech was very, very slurred and she seemed very confused. It's like she couldn't move one side of her body, but it's the right side of her body she couldn't move. It was all very weird. And I'm thinking, could it be a stroke? I remember learning about that in my neuroscience class in college.
Yes, the symptoms do seem to match up with a stroke, and that's what we're going to test her for first. What we do have to determine is whether it was an obstructive or a hemorrhagic stroke.
And a hemorrhagic stroke is caused by bleeding in the brain, right?
Mm-hmm.
And then obstructive is some sort of obstruction inside a blood vessel?
Yes, exactly. That's exactly what happens. And if it is an obstructive stroke, we also have to determine if it's a thrombolus or an embolus. And thrombi is when the blood clot forms at the site of the obstruction, whereas an emboli is when there was some kind of debris from some other part of the body that got stuck in the brain, and that's where the obstruction occurred.
I remember learning about that actually.
Yeah. So Taylor Ray is currently receiving a CT, or a computed topography test, and that's going to give us a visualization of the brain so we can determine whether it was obstructive or if it was hemorrhagic. And if it was an obstructive stroke, then we will perform a MRI, or a magnetic resonance imaging test, and that will give us a 3D image of the brain so we can see where there was some damage in the brain so we can see where to proceed from there. If it was a hemorrhagic stroke, we do have to perform a CTA, or a computed tomography angiography. That's when we'll actually inject some dye into our blood vessels to see where the clot was formed.
Thank you so much. I really appreciate it.
So we did determine that Taylor Ray had an obstructive stroke, which we were able to determine from the MRI that we performed. And so we decided to give her TPA, which is tissue plasminogen activator, and that actually converts plasminogen into plasmin. And that plasmin is actually an enzyme that dissolves fibrin. And fibrin is necessary for clots to form in the brain, so that will dissolve the clot and prevent it from being able to stay there in the brain.
Okay, so what exactly happened in her brain?
Well, the obstruction in the brain didn't allow blood flow to access the brain, so there was decreased levels of oxygen and glucose in the brain, which, as you remember I'm sure from your neuroscience class that you were talking about before, causes the neuron to depolarize, which causes this action potential. And it eventually causes excess glutamate in the brain, which causes excitotoxicity. So there's excess sodium that's in the cell. And excess sodium causes water to rush in, and it causes the cell to swell up.
Okay, and then that causes microglia to come in and kill neurons, right?
Exactly. So that causes the damage in the brain, because if they're swollen up and microglia comes in and starts to kill them, that's what's going to cause the damage. But calcium also comes in, activates some enzymes that causes even more damage, and the free radicals also cause more damage as well.
It's devastating.
For many people, it really is. But fortunately for Taylor Ray, the permanent brain damage was very minimal. We're going to give her some anticoagulant drugs to prevent stroke in the future, to prevent some clotting that could happen again. And if we do see some more damage in the next few days, we will keep her for a few days. Any motor damage or some language impairment, we'll run a few tests every couple days just to make sure. But there is hope after that because of the neuroplasticity in the brain. So we can do some physical therapy and some other things that do cause improvement after strokes because of the neuroplasticity.
Great. Thank you so much, doctor. I really appreciate it.